We look at the alignment of the spine and the mobility of the spine. We look at how the nervous system expresses itself. The moment of birth is the most impactful time we will ever have in our life. Everything is like packed into this, amazing haven of support, right? And then suddenly you're out in the cold air, your skin is wet.
Yeah.
You've never felt that sensation before. It's sharp. And then you take that first breath and it's like, the birth was a stressful experience for the mother and the baby. And the baby is more stressed later. So the baby calms down with our care.
I don't remember the time that I took my first breath. If I don't remember it, how does it affect me now? Welcome to the MedConceptions podcast, a podcast about health and living a mindful life. Today, I have with me Dr. Eline Pedersen. Pedersen, am I saying it correctly?
Yeah, correct. Very good.
So she's a chiropractor, graduated in 2004 from the Anglo-European College of Chiropractic, specializing in birth trauma, pediatric care, and pregnancy. She's an honorary past president and co-founder of the Forward NGO and an award-winning international speaker. Moreover, she's a mother of two, a female leadership role model, and a co-author of 6 books. That is quite an amazing resume.
A few of the things we've done, yes. That's good.
How are you today, Doctor?
I'm very good. Thank you so much for inviting me. I'm very intrigued by your podcast. I think it's fantastic what you're doing and very nice with MedConceptions. I like the title of it too. It's really nice to get a little bit of concepts from different, professions and your wellness, approach is obviously important in today's setting, in today's life.
That's what we aim to do. And I think getting concepts from very different disciplines, I think kind of helps what we call multidisciplinary work. I think we can discuss about this and how you implement this in your line of work. But I think let's begin with, why did you choose to become a chiropractor, and what is a chiropractor?
Yeah, it's a big question. It's really, I actually was looking at a few different options when I wanted to study. I was quite late starting to study because I did a lot of different things. I was working, as an entrepreneur early years, and I started to look into what I wanted to spend my life on doing more. And it was clear that it needed to be with people. And I actually was looking to become a midwife or a chiropractor.
Okay.
So the midwifery, and the reason was I really wanted to work with pregnancy and babies and infants, and the pregnancies interested me a lot. And so I was like, as a midwife, obviously I'll be working in that field. But then I discovered that chiropractic has a very important role in that field. So before I even started studying, I knew what field I wanted to work within the chiropractic setting. So that's not the most common chiropractic field. There are quite a few people working with pregnancy and pediatrics, but most often you would hear about chiropractic and how chiropractic works with the nervous system and the musculoskeletal system, trying to restore function in those two areas. So many people know about back pain and neck pain and sciatica and so forth. But we have a really strong relationship with our clients, and or many chiropractors do, where we inspire people to take on a little bit of a self-responsibility and look at the body as a self-healing mechanism and a self-functioning mechanism, where really our job is to help people to stay on track, to stay healthy, remove blockages in the way for the body to express health at its best from a chiropractic point of view. So we know that the nervous system is the controlling organ, and it needs to communicate very well, from the brain to the body all the time. And it's very good at compensating when something is in the way. So we try to help the body to stay out of these compensation patterns that are dysfunctional, where we are not working at our best, and to properly heal. So that's what chiropractic really is about. But in the chiropractic setting or in the pediatric and pregnancy setting, I found that I was always very interested in the natural ways of life. I grew up on an organic farm in Norway, have a very good relationship with my parents and the work around the organic farming. Also, my mother works with refugees since I was very young, and asylum seekers. So that was a huge people, and connection and understanding of different people and different cultures and different, problems in the world. And I somehow wanted to combine things a little bit and wanted to work with people. And I think everybody's psychology is very interesting. And that time of creating a family is just so special. And when you take on, the choice to carry a baby in your body and then have a child and take on that responsibility, and to bring up a child in the world today is, and for all the eons it has been such a natural process, such a survival, instinctual thing, but still so challenging in the world, right? So I found that was very inspiring, and that what probably brought me through to choosing chiropractic. It was important that it was independent as well. At the time, I couldn't work as an independent midwife in Norway really easily. There was just 1 or 2 independent midwives. I didn't really want to work in the system.
Yeah.
This was an early choice for me. I wanted to be independent and work for myself or with others.
You had the entrepreneurial side. That's
that was quite strong from early on. I guess with growing up also with my father, who was self-learned, with organic farming and pottery. He was an artist as well. He's an artist. So there was, a combination of things that brought it all together for me. And then chiropractic became a choice. I studied in England. It's also where I met my husband, Kostas, which is why I'm here in Cyprus. So, 20 odd years ago when we met and where we were studying, that was, a path that changed many things in my life. Not just the profession.
How has it been for you? Because you're a mother of 2 and you've also been doing all this amazing work. How do you manage it?
Yeah, that's a good question. I think it is, you have to be quite good at looking after yourself, and still be human, because, sometimes you have overwhelming times and, it might be disappointing times, or it might be just too much, but it's okay. We get over it. You just always keep working. And I think it's important to remember what your passion is. It's very, very important to work with things you're passionate about, things that gives you energy. Yeah. If you're in a job that just sucks the life out you literally, and at the top of that you're going to do everything else, I think it'd be very hard. But if you do something you love and you love to give, then it will always come back to you. Not necessarily where you give, but it doesn't matter. You live in abundance, you have a mindset of abundance, then you manage to get through those things.
And you're able to give to the people around you.
Yeah. And I think that we have a responsibility, if we have the resources and the passion, I think we have a responsibility to give back to the society where we can. I mean, how else is the society going to go around if we don't all take part and we don't all become responsible human beings in the society? So I find that at least, if you have the resources and the skill sets and the energy, why not do as much as you can? But it's important to take care of the family and the children. There has been times that's been tough, really, really tough, when the children were really small and, you're lacking sleep and you're in the rush hour of life, so to speak, it is an intense time. And right in the middle of that, I had 3 practices and I was bringing up not just my children but birth forward as well, and working on that at the same time. And it was hard, but I had very good support from my husband always, and I always believed that it's worth it. I can do it, and I never really felt that it wasn't right or that it wasn't I never wanted to quit. There was never a time that was an option, or it still isn't. I always want to keep going, and but you need to look after a few things, fundamental things, which are basics that we probably already have discussed earlier today. Is nutrition. You got to look after yourself in terms of exercise, sleep. From my perspective, get adjusted, and stay in a good state of health. Because if you are not looking after those things, then there will be times when you run yourself down, but okay, you do that and then you get it together again and you get up. Nobody's perfect. You're not going to do it perfect all the time. I do mistakes every day, all the time. And, I mess it up all the time, like we all do. But that's okay.
That's
you
normal.
Just pick yourself up again and you keep moving and keep going.
The important thing is to pick yourself up. Yeah.
Yeah, you have to have it's all about the mindset, really.
Yeah.
Because if your mindset is that, I'm going to make this, and you put it's so interesting because, bringing up 2 children in the society here, coming from Norway. I mean, that's a whole conversation we can have another time. But it is very interesting just to see the difference in personalities as well with your own children and with clients I work with. And you can see that we will probably come to this a bit later, because I think it has a lot to do with our personality, how we are born, actually. It's a big part of my work. But it is interesting that some people have just got, a very strong willpower or concept of like, yeah, I can do it. Like there isn't a wall that is, I'm going to meet them all and I can't do more. One of my children, he gives up much more easier. Yeah. But he manages things also really well. But the youngest one is just like a force. He doesn't see a limit, he just keeps going. And I admire them both so much. But it's fascinating to watch this little kid. He's 9-year-old, and we went archery today, and there's no thinking, I can't do this, like there was no such a thing in his mind, he just immediately goes and chook, he does it so well. And I think that's the thing with we as adults as well need to take on a bit of that childish, like I can do it, We
forget it
just
sometimes.
Believe in it, because we're told all the time that, you can't do this, you can't do that, have to do it this way or that way. Or, there's so many conceptual things in terms of how things should be done that we sometimes forget, who am I? How can I do things? How do I do things? And I think doing things differently is challenging. I've certainly done a lot of things differently in my life. And it's helped me that I'm in a different culture, because I'm expected to be different anyway. So that makes life easy for me. Much easier than being in your own culture where you kind of have to fit in. So it's been very, I think that is things that this sits in me as a force of life. But you need to look after the basics at the same time. Yeah. Follow your passion and then you can do anything. Really.
You're right. Sometimes we do set psychological walls. And in itself, those are barriers to us from achieving many things. I want to get back to the chiropractor practice. Mm-hmm. Why would someone go to a chiropractor?
Well, most people hear about us because of the back pain or the neck pains, like I said. Most people hear about me because of the children that has some sort of an issue. And they've heard it from another mother or another, father or their pediatrician. A lot of children come to me from the pediatricians in Cyprus. And in the pediatric field, it's often because the child has got the neck is tilted to one side, or the baby has a flattening of the head on the one side, so they're sleeping on one side. So they come because they want to help to level that up so the baby can sleep on both sides and even out that aspects of the flattening or the plagiocephaly.
Is it harmful?
Well, there are associated factors with some developmental aspects, which is why we should take it into consideration. Okay. So it is an important thing to take into consideration when a child has a defect or has a change in the postural aspect from very, very early age.
And is this due to birth trauma?
Very often there is a relation there, but we cannot say 100% sure exactly what it is. If it's the birth itself, or if it is the position in the labor before, or in the position in the uterus while the child was growing. It could be a number of things. If we had a glass bowl, we would know, but we can make some assumptions and some, narrow it down when we look at the history. So the history is very, very important. We go really thoroughly through that history. It's great when I've been able to see the mother through the pregnancy, because then I have an idea of what's been going on with her back and her pelvis and the ligaments of the uterus, because that matters to how the baby is moving and how easy it is to get into a good position and how easy it is to be born. And I specifically say it in that way because it's not just us birthing a child, it's the child that births itself through our body. Yeah. So the child is very active in that process. They have specific primitive reflexes that are helping them to push themselves out. And with every contraction, they wiggle themselves a little bit better into place. But then it's important that everything around it is in optimal function. So that's why the pregnancy work is very important, and why chiropractic care has become quite known through that field, particularly through a technique that I used called Webster technique, which is a technique to align the pelvic girdle and the ligaments that attach from the uterus. And it helps for the optimization of the neurology and the So, you want optimal contractions when you're going to
Yeah.
give birth. You want to be in a good fit state when you give birth. Just like as if you're doing any other physical activity or sports, in a sense, if you compare it, you want to be not going to run a marathon in stilettos. You want to be prepared physically and run in trainers, right?
Yeah.
And that's the difference. If you prepare yourself for birth, it is usually easier.
Mm-hmm.
And it's a more natural and better process for you and for the baby.
How would you know that the pelvis is, can I say, aligned?
Yeah, so we look at the alignment of the spine. So going back to chiropractic in general,
Okay.
what we're doing, we're looking at the spine, we look at the alignment of the spine and the mobility of the spine. We look at how the nervous system expresses itself. So we test the muscles and see how the muscles and the joints are moving and responding and actively functioning, so that we get an appreciation. We screen the body in that way. So we palpate with our hands, we look at the mobility, the physical, like active mobility, the passive mobility the person can do, and we look at how the nervous system functions. So when we have analyzed all of that, and then we have looked at all the history, so we go through the history in great depth, because we want to know about every injury that somebody might have had, even how their birth was, and how, what kind of life they have had. Have they been healthy throughout their life? Have they had lots of accidents? Have they been, driving go-karts and been to hospital 5 times? It matters how the spine takes it, because the spine is designed to absorb stress, right? I mean, it's designed to keep us going, right? To absorb and to keep us up. We spend about 60% of our energy to just be upright. Now, if you're upright and to the side or stressed, intense, and in pain, we might use more energy than we have, and you're tired at the end of the day, right? Because you've been in pain and your body is in tension. So that's why people sometimes feel exhausted at the end of the day, just because of postural tension and pain. Now, that's quite common, as we all know. A lot of people suffer from that, and it's a very, very common reason why people would go to the GP, and why they would also be off sick is because of back pain. Yeah. So chiropractic is very important in the world from that perspective. We want to work with people's posture and their neurology and make sure that everything's functioning well, so people can be in less pain and have more energy, because you're using up too much energy on pain and postural tension. So that's from a just very broad perspective. So people come to us with pain, but they stay to, not just to stay well, but to be in an optimized state, right?
Yeah.
So to really be switched on. And that's one of the powers that chiropractic has, is that when we adjust the spine and we check and release the tension on the spine, you are obviously with more energy available, right?
Yeah.
And you have less tension that is keeping you back. And the body can express life in a better and higher state.
I have to say, we did a little session just before we started the podcast.
Yes.
And I was pretty amazed.
Exactly.
Just with a few cracks, I do.
Well, it's important to say that we don't crack the spine. We actually, correct the spine. So this is really, really an important thing.
You correct the spine. Okay.
We correct the spine. So yes, we hear some popping sounds, and people are sometimes afraid of that, or they really like watching it on YouTube and all of that. But, it is about correcting the spinal function. So that's where we talk about the mobility and the positioning of how the joints are positioned and how they move. And we are correcting dysfunction of that.
And the popping sounds, is that?
It's little gas bubbles that releases from the joint. So because there's a pressure within the joint when it's restricted. And, often you hear that even when you move sometimes. It doesn't mean that anything is getting injured or snapping or breaking. It's just little pressures that are released. So that's not actually the treatment. The treatment is the movement we're doing and the restoration of the function. But it's a nice side effect that people often love, because it feels like a release. Often people do it themselves, right? They crack their neck, as we say. And that is cracking the neck. That is not correcting spinal function.
So when people do it by themselves like that, I have some friends, they'll just crack their head or...
Yeah. It's not great, because you are not really correcting the dysfunction that's underlying. The fact that they feel they need to do that, nobody should feel they need to do that.
It's just psychological.
No, they have a dysfunction in the spine somewhere, for sure.
Oh,
but they're not managing to correct that with these movements that they're doing just by themselves like that.
Okay. And do you think that worsens it as well?
It potentially worsens it, yeah. Because you're getting more slack in some areas, and then you're hypertonic in some areas and hypotonic in other areas. And that imbalance creates more tension in the end. So, yeah.
So narrowing down, let's say, to pregnancy, we said a lot of women may have this... in alignment,
imbalances,
and then they would come to a chiropractor, which would help them with movements What else do you do?
Yeah, we do the adjustments.
The
Also in
adjustments.
pregnancy. It's very specific for the pregnancy. So that it's very, very safe. That's a really important thing. It's
So
very
a session,
safe,
how would a session look, for example?
Yeah, so with initial examination is very important because that's when we establish what's going on.
Mm-hmm.
And that is when we look at the history, as I said, we look at the function of the spine and the nervous system, and then we will address and explain everything, explain about how long it takes, like what the healing time is actually about. Often people have a bit also, an idea that pain is just, it just needs to go away and then everything's fine, right?
Yeah.
It's like, oh yeah, but the pain is gone and I'm fine. And I say, well, the function underneath, like even if you sprain your ankle, let's say,
Yeah.
you might after a few weeks feel quite okay, and then eventually you walk on it and you're like, oh yeah, after 6 weeks, if it sits in a good place and it's healing well, you will feel fine, right? But if you sprain it again around 9 months later or a year later, what happens? You know that, I actually sprained that, a while ago. You know that wasn't a good idea because it is worse the second time, isn't it? Why? Because the tissues inside haven't healed yet. So tissue healing actually takes 12 to 18 months. This is basic physiology. You know this from your studies, But we don't apply that knowledge sometimes when we think about, I'm in pain and I'm going to the chiropractor.
Yeah.
And you think, how is the chiropractor going to help me for this? Well, the body, first of all, has to do the job. The chiropractor has to remove the tension and get the mobility back so the body can heal. But the healing takes time, which is why we have a course of care that happens and reassessments on regular basis to make sure that correction and that healing is happening underneath the surface.
We also have like a similar thing in medicine with the course of antibiotics. People take their antibiotics, they feel better, then they stop them. And then it comes back. And it's like, no, you have to complete the course. Although you feel better, you have to complete the course to ensure that the infection is totally gone. So I guess it's...
Yeah, you could apply a similar idea because it is about understanding a bit more. That's what we do in that session.
Yeah.
Is to explain about what is the situation for each individual person. Because it's different from each one. If somebody just slept funny yesterday and they have no trauma, nothing wrong with them, nothing ever happened to them, but they slept funny and they woke up and they had a stiff neck, it's probably not going to take me that much work, right?
Yeah.
Or if somebody had a car accident and they've had, 5 years studying like this and they're sitting on their phone 50 hours a day.
This reminds me of me.
Which is, this is the worst thing now that we before used to talk about just the work position was bad, right? Now it's the work position plus another 20, 30, 40, 50 hours on the phone. This. It's completely different from a few years back. So we're seeing very different impacts on people's spines now from the technology and than before. And that's a problem, in general terms. And children particularly, because obviously, of course, I work with children a lot. And the things we see now in the spines of the children, stuff we didn't see before after university in the past, really.
Yeah.
Like these particular
because of the tablet.
Yeah, tablets and phones. It's scary. It really is a bit scary. So we have to think about that and help our children to sit better and get the phone up in front of them instead of sitting and looking down of it. So just get the elbows on the table
and then
hold it up so that at least the spine is straight when they're watching it, if they have to watch it for that long. It makes a big difference. So this is what we need to help the population to correct their postures. So
going back to the birth trauma, you said it's very important the first breath that the child takes.
Yes.
So what did you mean by that?
Well, this is a big one.
And what can go wrong and right, and where do you come into this?
Well,
lots of questions. Sorry.
Yeah, that is a lot of questions. Where do I start? So there is the first breath, the very first breath that a human being takes is it's a huge transitional moment at that time. The baby's born, but then they have to take that first breath. And that is a transition when all the blood is coming through the umbilical cord, and then you take a breath and the oxygen is starting to come from the breathing apparatus and not just from the umbilical cord. Now, the longer that transition is, the better it is, or not maybe always the longer, but it should be a decent amount of time with the oxygen coming from both places, right? Both from the umbilical cord, which is why we don't cut the cord generally early, right? The advice globally is that it should be left to pump for a while the baby is establishing their breathing, because then you have transition of oxygen from both areas and there's no dangers, no risk. The baby's iron level comes up because they get their blood from the placenta. 30% of the blood sits in the placenta. And that has to come into the baby. It's the baby's blood, it shouldn't be cut off and left in the placenta. It should come to the baby.
Yeah.
So there's so much going on in this time. Not just that, there's all these amazing things that we don't even know all of it yet. What is in the umbilical cord that comes in, stem cells, everything that's coming through into the baby right after or right during the birth and in the few, moments after birth, while the baby is also establishing their first breath. Now, there are a million scenarios we could describe, but what is described by many doctors and people that work in psychotherapists, people from breath work, and also us observing it from the chiropractic point of view, but particularly midwives, I think, are very important in these conversations as well, because they see what happens, at the moment, and gynecologists as well. The baby is born. And but when we listen to the breath workers, the psychotherapists, it's interesting because they were talking for a long time about that the moment of birth, the time that you take your first breath, is a point of decision making. So if you come out and you take that breath with ease, and there's been many things going right before that, including a fearless pregnancy, a good, fearless birth where the mother is in touch and able, to be listening to what is needed for the baby and for herself, and then giving birth in the best possible way without a lot of fear and stress and, the stress hormones being high, but actually being in a relaxed state. Then the baby takes that first breath in hopefully an easy state, right? Relatively easy state. I mean, a birth is big anyway, whatever birth it is, right? But that moment when you take that first breath, maybe it is a moment where you take a choice as well. Like if you come out and you're, pumped full of adrenaline and fear, and there's a point of anxiety really coming out, so the ear is cold, the light is sharp, there is stress, there is a lot going on, and there's a fearful situation. Maybe you come out a little bit in a fight-flight mode, right? Yeah. You're probably a little bit in fight-flight already because it's a big transition. But if it could be diminished and be in a most suitable and most, admirable state, almost easy state, I would use ease as the word, probably describing that more. Maybe we would see a different way of how that child takes a decision about how they're going to respond to life. And this is what is interesting for me, is what happens in that moment when we come out and we take a choice about what is this, what happens, how am I approaching this life? Yeah. And the way that we hear from the psychological point of view and from the psychotherapists and breath workers is they describe that moment of birth as often a point you often go back to see, like that's your major trauma, like your major sort of big area in life that often goes back to that time. I'm not sure if I can describe it 100%, but I'll get to it so that you can see it from a few angles. So if we then look at that moment being, a moment of ease instead of being a moment of fear and tension, you would then likely build a pattern from that moment. Now, if we look at Michel Odent, who is a very well-known gynecologist, and he is now in his 90s. I've had the opportunity to interview him and spend time with him, but he is an incredible person in the history of gynecology. He was the one who brought one of them that brought the water births back into, and he was really speaking about the moment of birth. And he has a primal database, it's called a primal research database, where he took research papers and looked at retrospective research papers, looking at questions being asked retrospectively, meaning that 20 years after birth, you ask questions about how was that person's birth, how was that person's life, what illnesses do they have, everything in their life, right? So he looked retrospectively, and they saw what his conclusion is from all of his retrospective analysis was that the moment of birth is the most impactful time we will ever have in our life.
Wow.
So, and they are also talking about this from the ACE study, the adverse child studies. They are also talking about impacts at early life, psychological or physical impacts, and how that affects us, not just psychologically, but also in terms of chronic disease in certain areas. So you bring all of this together and you look at when is the most impactful time in our life, and what effect does that time have on the rest of our life? And how can we make that moment the best it can be so that the effect is as minimized as possible in terms of negative terms anyway? So if we take an easy breath, and the first breath is an easy transition to the world, and you're infused with oxygen, there's no either fear in terms of, do I have enough oxygen or not?
Yeah.
Right? For example, I think that's very, very important. That's also suggested through a lot of research, but it is important with that transition of oxygen, because if you go into fight-flight mode because you're lacking oxygen, that is probably quite a dramatic experience for the body, I would assume.
Yeah.
I think we could all transition into thinking that would be a profound experience, neurologically and physiologically and emotionally, if you have a fear of survival, literally, right? But let's say that the blood is there, but still there is a lot of other stressors. Again, the impact of it, the cold air, you're coming out and you're literally coming from a wet, warm environment. Everything is dull. The sounds are dull. The light is dull. Everything is like packed into this, amazing haven of support, right?
Yeah.
And then suddenly you're out into cold air, your skin is wet.
Yeah.
You've never felt that sensation before. It's sharp. And then you take that first breath and it's like, the lungs open, like they open for the first time, like that, right? And there's sharp feeling of the air. There's a stress, in that moment. I'm questioning it, and I'm getting that question from many people, and I want to have that conversation in a bigger setting, and that's something I'm working on with different people around the world, where we are coming together to discuss this moment. What is it really that it has? What's the physical impact on our life? What is the emotional impact on our life? What is the economic impact of our life? What is the psychological, spiritual impact of our life? What is it that happens in that moment? And can we do something
to make
globally, knowledge-wise, to try to make that moment as perfect as we can, even when there is a Caesarean, let's say, or even when the situation isn't perfect. If we have the knowledge, we can augment the situation and try to at least bring it to the best position, so that moment when that first breath is taken and those lungs are opened and life literally starts by itself, as an individual, still very dependent, obviously, but we are at least a physical being that's individual, right? And not inside the mother anymore. Still, we're individual inside, but a different level. That moment, I think, is very important. So I have a great passion for that. From a chiropractic point of view, I see, repetitively the children that are coming out and they have had a stressed birth. And that is one of the reasons why one of the things that sits in the history is that the birth was a stressful experience for the mother and the baby. And the baby is more stressed later. So the baby calms down with our care. So they are calmer in generally after the chiropractic care. They might come for different symptoms, but what we see is that the nervous system calms down. They just kind of take their first breath in my hands so many times. You can see that they've been tense. From the moment they're born, they've not rested. They've been in tension, in hypertonicity, and in a fear state.
Do you think this is...
They get to take that first breath and relax, and then suddenly everything falls into place. The body can start digesting, it can start relaxing, it can start sleeping, it can start, things come into place, the things that doesn't get to play if you're in a fight-flight response, right?
I've got a childish question. My question is, I don't remember the time that I took my first breath. No. And I guess most people don't. But if I don't remember it, how does it affect me now?
Well, the breath work is very important or very interesting in this matter. So there's a whole profession called breath work. I've done the breathwork training, but I'm not a breath worker. I collaborate a lot with breath workers. And they often talk about the experiences that people have when they're doing the breathwork sessions, that people often say that they come back to their birth. They are experiencing their birth again. This just sounds maybe a little bit sort of out there, but it's not. I mean, it's actually quite... imagine if you have an accident or something happens. What's the first thing you do?
Adrenaline rushes. I don't know, you flashes.
The first thing you do is take, your breath stops. Very first thing. And that kicks off the other actions, right? Yeah. The input that you have on your eyes, on your ears, on the sensations, everything you see in slow motion in that moment when an accident is about to happen. Yeah. But one of the very important things is that your breath gets shallow immediately and you stop breathing. right? And then you can feel dizzy and all the other sympathetic responses to that, which, you know, it's a big word, but the sympathetics is like part of your fight-flight response when you are in fear or in danger. And that response, you know, sometimes people, let's say that it wasn't the birth, let's say it was another time in their life, but you had a fearful experience, and then it becomes a trauma and a fear later, right? And you're scared of that situation. Or a child that gets barked at by a dog, really, you know.
It's a trauma, basically. I'm saying this is trauma.
Yes,
trauma when you're...
And part of trauma response, we have to talk about the physiology. So this is what interests us, and you will understand this from your background, that it's a trauma response, like it's a fight-flight response, right? And then you lock up, and to release that, you have to work on your breath again. And to get that breath back.
Even if you don't remember it, it's still lingering in the background.
A lot of our traumas are unconscious in life.
That's one of the things that,
Right? You're a child, 1, 2, 3 years old, you maybe don't remember that you fell off the roof or you did,
that's why you're afraid of heights.
You're afraid of heights. You know, very vividly afraid of heights, right? If you fell down a height. So if we remember very well. It's just maybe not surfaced to a conscious level that we remember. But this is an important thing of chiropractic. An important thing of this conversation is the tissue memory.
Yeah.
So there's tissue memory. Your body remembers very well and it compensates very well. Yeah. And that's exactly the point of what we work with all the time with chiropractic, and many other professions tap into this in many various ways, which is why I love multidisciplinary work. I mean, I collaborate with every profession and have very good relationships with, you know, including your father and you know, from GPs, neurologists, psychologists, psychotherapists, you know, gynecologists, pediatricians, because we have to collaborate, you know.
Yeah.
To collaborate to know what's the best for each person.
You get the view from different viewpoints.
I remember even when I was a student, I used to create multidisciplinary seminars.
But yeah, we were just talking about...
tissue memory. I think we were at the tissue memory is their level, So it is about, it's very important, that aspect about how the body has experienced the trauma and to unravel that. I think that's what, you know, sometimes even as chiropractor, maybe we don't think about all the depths of what we're doing, you know, like on a day-to-day basis. You know, we are helping people with their pain and discomfort, their posture, their life in general, but the real, you know, thing that's happening underneath is that in the beginning, at least, you know, when we are first working with somebody and we kind of unravel all their traumas. Yeah, it really is about that. It's like unraveling the trauma, the tissue memory, and starting to get the body to restore itself in areas that it wasn't able to because it had compensated.
I've got another question. So I think this is the psychological aspect of it. So let's say it's a traumatic. This is how I'm understanding it. Please correct me if I'm... So it's the traumatic event of the lack of oxygen and the mother who's under stress and the bright lights. And you said, what about the aspect of the actual delivery of the baby? If the doctors at that point maybe use different equipment to pull out the baby, maybe there's some physical aspect of it. Because I guess the baby's bones at that point are very soft and very, very malleable. And I guess at that point you can have, I don't know, I'm just thinking.
Yeah, no, it's absolutely true. So this is a big part of it. You know, like one thing is the breath. We talked about the breath, and this, I was in the context more of like, my really big question around that is like, what does that moment of taking the first breath, what impact does that have on our entire life from there on? Okay. Right. This is my big, you know, sort of mission question that I'll be working a lot on in the next probably 10 to 20 years, I think, with collaborations that have already started. Yeah. So that is important. But when we talk about the nature of birth, so which can be many different things, right? It can be, yes, a natural birth where everything flows easily and the baby is able to come out with ease by themselves. But sometimes, yes, they use instruments, so they use, you know, forceps or ventouses, or we even have the Caesareans, you know, sometimes even there we have to use the forceps or the help to get the baby out. So it is obviously these things are quite intense, you know, on the physical body. We are probably very rarely afterwards gonna be in a situation, unless we're in a car accident, to have, you know, some similar force on it. But we don't want to make that association, because it is not like that initially. The body is very, very, very able to go through a birth channel, right? And it's a complicated one. it is going down and then 90 degrees, and then it also twisting at the same time and coming out. So the human birth canal is very complicated compared to many other birth canals of other mammals, and because it goes both down and out and twisting at the same time. If the baby is in an optimal state, right? If it's not in an optimal state, that complicates this pathway immediately. But there are, I just had last week, or a couple of weeks ago, I ended up in a labor. For various reasons, I ended up there, and the birth had stagnated. And I came in, I helped the mother, I adjusted the mother, and things started moving, and within a couple of hours the baby was born. But it had been quite a long process over several days, and when the baby came out, the head was really locked to the side. So the process at the end was okay, but the whole process throughout the birth had been very long and maybe put the baby under quite a lot of pressure. So yes, there is an impact on that. How the birth has been physically. So actual physical trauma is a big part of it as well. And we see that sometimes we don't see the symptoms of it. We don't necessarily see anything on the baby unless the baby's head is over to the side, or there is a bruise or fractured clavicle, or the different more normal birth traumas that are seen relatively frequently. The baby can heal, the baby can get over that, that they are so resilient. It's amazing how resilient they are. They manage to breastfeed, they manage to do all these things even with the most incredible stories and incredible traumatic births. I'm so amazed by how the body can survive. It's very, very strong in survival. But is it optimal always? No, that's where we got to remember that survival mechanisms are very strong. So even if there was a traumatic birth, the baby's gonna, in most cases, manage it in one way or the other, and even manage to feed, and even manage to thrive, and even manage to grow. But if we can help the process to be easier, that's really where I'm coming from. Can we reduce those tensions that was created on the spine? Can we reduce those tensions that were created on the muscles of the mouth so they can feed better, suck better? Yeah. Those very first things we have to do is breathe and suck, right? Yeah. Two first things that has to happen. So that nervous system that goes through our mouth is so important. It's so important that it doesn't even go into the spine and then to the organ or to the mouth. It goes directly from the brain, doesn't it? Like the cranial nerves, they just come from the brain and go straight to our face so we can smell, suck, find a nipple and get on it and get fed, right? And it's so primal. It has to happen right away. And so it's primal reflexes that we're talking about when we talk about the cranial nerves of the body. And the cranial nerves are activated immediately at birth. Our postural muscles and reflexes come later, right? When we have to get up and roll and then crawl and then walk and then talk. We want it in that order. So as a chiropractor, I work a lot with the development of the baby and how they are managing through particularly the first 18 months. Because in the first 18 months, we establish ourselves physically and neurologically for how we will develop later cognitively and, in terms of all of our other faculties.
Are there adjustments that can be done at that age, or is it dangerous? Because I've heard the thing that, no, don't take your kids to a chiropractor, it's dangerous. There's
it's very safe. It's very, very safe. And it's so safe that, really... Actually, you're probably better off taking the child to the chiropractor than not, because it helps their development and their neurological, constitution. So there was a big study done in Australia just a couple of years ago, which looked at side effects of chiropractic adjustments in children. And it was a retrospective study again, looking back at children it was 27,000 cases that was analyzed, and there was 97% of I shouldn't quote this exactly, but I believe it was 97%, we can find the reference, that of the mothers or parents that brought their children were very, very happy with the care. Meaning likelihood of that there were side effects was extremely low, because people would not be happy if they had severe side effects with their children. So it's so safe, so safe. The adjustments are so gentle. It's not more pressure than what I would put on my eyeballs. Because we don't need to force the spine that is not even bone yet. It's just cartilage at that age. The first bone of the spine that really starts to ossify properly is at the atlas after age 1. So, before that, we want things to be in a good alignment, because it's going to solidify as bone after. and then we grow our bones until we're 24, right? That's when our skeletal maturity is completed, usually around that age. So there is a huge process in terms of helping children to be in a better place because huge potential because they are still growing.
Yeah.
When we come to adults, the damage is done. We have to work with what we have and the traumas that we have, but you have a little bit less potential to fix things, at the same stage, the same rate that you can with a child, because everything is mature and everything is kind of. But there is we have to put everything in context, right? Because there is every person is different. Every child is different. There might be many things that's coming together. That's why I love collaborating with the pediatricians particularly, and I work a lot with the prenatal department as well, or the prenatal children in Cyprus are often referred on because they have difficulty coordinating their mouth muscles and the neurology of the mouth. And so the speech pathologist and the speech therapist in Cyprus that work with the babies to be able to suck when they are premature, they send them over, and then we work in a team, So it's the physio, it's the speech therapist, it's the neurologist, is that we're all, working with these children together to help them to optimize.
You mentioned a few studies, and this is one of the things that I wanted to ask is the evidence behind the practice, and especially in children. So you did mention the satisfaction.
It's very little. I mean, really, the only thing that I officially can sort of, say that this has been studied well enough is that babies are calmer. There's so little research done on that level. There's a lot of case studies. There's a lot of experiences that are there. There's a lot of books written. There are papers written. There are case studies written. But to do a randomized controlled trial on something takes a bit of not
just... It takes time and it takes people.
And you isolate the situation, which is the problem with a lot of the research, is that, you're taking it out of its context. So, if you have a healthy plant, it's a healthy plant that looks excellent, but if you then study it, one day with the right soil, next day with the right water, and next day with the right sun, you would complete that none of that worked. The soil wasn't good because the plant died. The water wasn't good because the plant died. The sun wasn't good, the plant died. But you have to study it together. It has to have water, soil, and sun to grow. And a lot of studies are isolated out in that way, that you take out one factor and you study that in isolation, and it doesn't look at the complete picture. And this is a problem in research, and particularly in health, because if you isolate one aspect of health, and you don't look at it in its entire environment, then we have a problem with it concluding that, water is good for you, and sun is good for you too, and you need to actually grow your body in the right environment, right? So chiropractic is very much about optimizing the environment for the body to thrive on its own.
Yeah.
And so how do you study that, really? But so there's very clear evidence on sciatica, on low back pain, neck migraines, headaches. We have huge randomized controlled trial that says that. Even the NICE guidelines in UK, if you look at sciatica and chronic low back pain, it says that, manipulation or adjustments together with exercise is the best option. Better than anything else. They've disregarded so many other things like ultrasound and interferences with different types of electrical interference and so forth, and medication even. Like you're better off doing chiropractic or manipulation from somebody, osteopath or chiropractor, and the exercise together. So that's it's established in the NICE guidelines, which is the general guidance that's given in UK for. So I think that's quite clear in terms of the most common cases. So probably we see 60-70% of the practices, around the world are working with those cases that are very, very well established. The evidence for it is very, very good on high level. But when it comes to children and it comes to pregnancy and that, it is very difficult to do big enough studies on it. Mm-hmm. And that is a problem for us. But at the same time, there is a reasonable amount of case studies and there's a reasonable amount of evidence out there to suggest that it's safe. First of all, parents are very happy bringing the children to the chiropractor. My children are calmer when they've been under chiropractic care, and that's established. So if we establish that and there is the recommendation, then in the lack of other modalities to help that are non-invasive, is a pretty good thing to try for your child if you have any concern about their development, or if you have any concern about the symptoms that most people bring their children to chiropractic.
I do want to comment on one of the things that you said. The fact that this thing that with research we get one variable and we test only that, and we test it in isolation from all the other variables around it. I had a discussion with the past chair of NICE, Sir David Haslam, and he mentioned that a lot of the guidelines that NICE makes, that they test specific drugs, they test them for people with one condition. Let's say you have hypertension only, but most of the patients come in with like 4 or 5 different conditions. They have type 2 diabetes, they might have IBS, they might have, and then the guidelines that we have are for that specific condition. Of course, this is a big challenge for research, and this is something that hopefully people out there, I really do have hopes, because I think that we have a lot of bright people in the world, and there's a lot of researchers that we can make the leap and
but what's just important to remember in that context is that as a practitioner, whatever practitioner you are, you don't rely on all your clinical execution on the research only. There are 3 factors that you always bring in. One is the research. Second, it is the education you have and the knowledge you have, or your background or your experience, all of that. The third thing is also the patient's choice. Right? Those 3 things comes better together when you talk about clinical reasoning and conduct of care. So it's very important that the parent is informed. I mean, that's a whole reason, core behind Birth Forward is about informed choice. In the context of childbirth and becoming a parent and creating a family. But in any clinical setting, which is also from the compassionate care context, is that we have to also look at what the patient wants. And in many cases, we have a lack of better, models, lack of better opportunities, lack of better, like, do you choose, medication first, or do you choose to work with psychologists first? Let's say if it's a psychological thing. Like, it is down to us. That's why it is so individual. It is so...
I agree with you.
So strange. Totally it's a very, very difficult situation and conversation.
Put people in boxes.
You can't put people in boxes. You can't put doctors in boxes. You can't put drugs in boxes. You can't put anything in boxes. That's why we have to be, really, we have to be first and foremost honest as practitioners, because we do not want to take advantage of anybody. It's their health, it's their body, it's their choice at the end of the day. We can offer our knowledge, and we can offer to also describe them the best evidence available, the best, research available. And then the patient or the client has to take a choice to what they would like to do. And this is important. And I think this is being forgotten many times, when we are in
I strongly agree with you on this, because, a lot of the times it's, this is what the book says, this is what you should do. But you don't take into consideration the person. And the person,
the person knows themselves better than anybody also, right?
That's why you're doing this. The person came to you for help for them. They didn't come. There's another study that showed that, again, Sir David Haslam mentions this in his podcast, a lot of the doctors, the treatments that they chose for the parents, for their patients, they would not choose for themselves. So for cancer patients, they would give a lot of treatments that if they were in that position, they wouldn't choose. So that comes to show something about the person and their choices. I want to move on.
I think we leave that conversation.
It was very interesting.
It is interesting. I'm very passionate about the evidence-based care, but I think we have gone a little bit from evidence-based care to evidence-guided care. I mean, if you look at the language that's being used in terms of care now, and the NICE guidelines also uses this, but I've been in many different scenarios where we talk a lot about what is appropriate care. And as chiropractors, obviously, we've been through many different scenarios over the history where it's been challenged heavily, if the evidence is good enough, if, so many things. So I know this language quite well because of what I've been working with, but there is a shift in terms of talking about evidence-guided care. And that's where you have to have that conversation about not just the research or just your experience. It's like your research is your experience and the patient's choice. And that's where we have to look at, particularly in some countries like Cyprus, where we have the highest Caesarean rate now even up to, closing 70%.
Why is that? I wanted to ask, why do we have such high Caesarean rates?
It's many things to it. And I think there's not one thing to blame at all. I don't think so. I think there is a cultural tendency that we have to take into consideration. It's a question we get a lot, and it was my question, right? Yeah. Why I started and initiated Birth Forward was because I had this question: why are we seeing interventions in birth when there was a perfectly normal, perfectly healthy, pregnant mom with no complications go in and she ended up with Caesarean? Why? And I really started asking questions. Why? I started attending births, wherever I could to see why. I started attending births in private hospital, in home birth, and here and there and everywhere to try to be able to see what is going on. What is the difference? Why do we have these stats here? And it's been a long journey. It's been very challenging. I've learned so much. And the collaborations, the founders of Birth Forward are from every walk of life, including parents, including academics, including people in practice, including people that have had good and bad experiences. So the founder members are from all walks of life. And there was 3 bridges with NGO. We're moving into that now. I don't know if you...
No,
okay
continue.
So Birth Forward is a non-profitable or NGO, right? A non-government organization established in Cyprus in 2016 as an NGO. And we started the work even years. My first initiatives actually was already back in 2007. Mm-hmm. But then slowly I had my own children, and eventually, I got on the job properly. Mm-hmm. And so I was asking these questions, and I have found many other people, midwives and parents and doctors and psychologists. They were asking the same question. Well, why is it like this really? And we started to get together to see, what can we do about this? Can we do something, in Cyprus to first understand the problem and then do something about it? So, Birth Forward was established, and it was established with 3 bridges as a concept. One was that we wanted to bridge the time from pre-pregnancy until having a baby. Because again, we have paediatrics, we have gynecology, we have, it's separated again medically, which is fine. But as a non-NGO, we wanted to kind of have the knowledge across. The other thing was that we wanted to bridge the birthing or pregnant parent or parents with the providers. To talk, to communicate, to collaborate, to think together. Well, what is going on? And then we also actually wanted to bridge the 2 sides of the island. This was one of the passions I had. And that has phased out in a nice way through Baby Body Forward, which is the web app that was created with Erasmus Plus funding, and with 5 partners from Germany, Greece, UK, and Cyprus. Tobacco was the main partner or the manager of the project. So we created a web app which has over 200 small videos, and it's 400 Q&As. And it's around the whole subject from the moment you get pregnant until the baby is 6 months old. And it's called Baby Body Forward, or you can go babybody.com.cy to sign up. And you can sign up as a professional or as a parent. Fathers can also sign up. And it gives you then in the web app the time, from the time you are in the pregnancy if you're a parent. And it shows you every day information and videos for that time of your pregnancy throughout. Yeah. It's based on a very strong app in UK called Baby Body, and which was made by Best Beginnings. Is by far the most scientifically evidence-based, app that exists on the planet. It is extraordinary work behind that app. So we took the app to Cyprus, we analyzed it, we did a participatory action research with the funding, and created the app as an outcome. Or the web app as an outcome. And it was so interesting because we facilitated groups to analyze the data, analyze the films that was from before in terms of if they were appropriate. Are they, is this the right video setting or the way it looks? Is it the right information that we need from Cyprus? For Cyprus, we wanted to add in, for example, information about smoking and about car seats, which they're past that in UK. They didn't even have it really in the app, whereas in UK in the same extent that we needed it here. But it's made in and translated into Greek, Arabic, Turkish, Russian, and English for Cyprus, and is adapted to Cyprus and created for Cyprus. Many of the videos are created in Greek, and within the project, the partners in the project was also the Gynecological Association, the Pediatric Association, the Ministry of Health, the whole lot.
Sounds like an amazing resource for...
It's an incredible resource. So we have 10,000 births in Cyprus. That's the cohorts. We have very high Caesarean rates, and it's gone up since COVID, and it's gone up since YESI.
Yeah.
Was established. Unfortunately, that's the fact, and it's come out now recently that it has increased the rates actually in the last year. So there's various reasons again for that. But I think it's going back to why, your question was why is it like this? The other thing I just need to say there in this context is that Birth Forward, apart from being the 3 bridges, what we want to work on was first and foremost information sharing, right? So people could be informed.
Health literacy.
So health literacy. Secondly, we realized very quickly that we had to supply support, because as the health literacy came out, also people realized what's been happening, and they had to revisit some of their traumas, because they realized that some of the births were not necessarily handled the way it was necessary to be handled, or they were handled differently from what was necessary.
And I think we forget. Sorry, I'm gonna interrupt you here. You said we were talking about the trauma for the baby, but there's also trauma for the mother.
Of course, huge. I work as much with the mothers as the babies, and I always say, actually, when people come to see me, we offer them a mom and baby appointment as the initial. When they come with their babies and they hear about me because something with the baby, or the pediatrician said to come with the baby, I always offer them to come, the mom and baby together, because they are like one, really. They are like one, and the baby and the mother births together. They are two amazing organisms that are creating this incredible symphony together and birth together. If you look at the hormones like an orchestra, right, they all are in tune perfectly, and they all doing this beautiful work together, mother and baby. And then as soon as you start augmenting or start interfering,
everything
it starts to change. The whole process changes. So
going back to
going back to that, but so it is. Your question was now. The last question was about
the mother's
the
trauma.
mother's impact. So the mother's is equally important. So that's why I create this appointment for both, because I realized with my experience over the years, having worked with this now since 2004, that if I don't look after the mother is often half the stress sits with the mother. So the mother needs to de-stress and relax and feel better in her body, because they're often in a lot of pain afterwards. There's the pain from maybe the epidural, from birth process itself, the pelvis literally opens, or if it's a cesarean, there's a lot of difficulty, we're just getting moving again after that. So they just need help with that. And sometimes there's the pain from the breastfeeding. So this is a typical thing. You see a lot of neck pain and upper back and headaches and things like that. And it's because they have to sit and hold the baby so many hours. So when mom's relaxed and the baby relaxed, suddenly both of them can, be in a better place. So this is obviously as important to look after the mother as the baby, of course.
And you were talking about the support that the Birth Forward provides to the mothers.
The support is there's literacy, the support, and advocacy.
Okay.
So advocacy has been more in play this year. We really have worked much, much more on that aspect. So now we have a representative in the parliament. Whenever this conversation is there, we are, invited to the parliament. So we have that space now, and it's the place where if there's any questions, anything coming up in the media, we will always be contacted immediately to have our opinion about it, because we do have a very strong and healthily balanced opinion, because we have never ever gone out and said, this is the doctor's fault, or this is that. It's been perceived like that sometimes, and we've had some fights around that, but really I think everybody understands now that is in the field working with this field, both from the professional organization's point of view, Gynecological Association. They know that we are not against anybody. We just want all of us to work together in Birth Forward to create a better space for birthing and more knowledgeable, more informed space, where the mothers are and the fathers or the couples or the single people who are pregnant and are going to give birth are able to make informed, autonomous decisions about their own health, about the baby's health, about their birth, about their pregnancy. It's very important. Very, very important to be informed. And that is probably the biggest problem. If we have a big problem, it is that there's been a lack of informed information and choice.
That's what we're trying to do here.
Yes. So that's why I'm here with you, because I think that if we could just do that, get compassionate, care and
Informed
give information, give them some of the people that I collaborate with in this country are amazing. They're so good at giving information and give people. One of the doctors that I spoke to, for example, he says because many women also come and ask for cesarean in Cyprus. So this has been one of the excuses is that women come and they want a cesarean. Says okay, we give a cesarean, but 9 out of 10, one of the doctors quoted this, 9 out of 10, when I sit down and explain everything and we look at the whole situation and they're informed about it, 9 out of 10 will choose not to if they came in with the perception that I want to.
A cesarean, yeah.
Right? So what does that tell us? They were not informed in that decision that was made out of whatever reason, fear of the pain, because whatever, it could be so many things.
Yeah, and the people around you listen to people around you which have some false conceived.
That's why we want to inform also all the generations, right? We go into the school, we want to inform the elderly generation as well. But really, we need to inform the young generation about their choices and about their bodies and about them before they get into the age of even creating a family.
What is some practical advice that you would give to mothers who are either pregnant now, who are planning to have a child? I think one of the first things is go check out Babybody. Babybody.com.
Babybody.com.cy.
Okay.
That's where you sign up, and it's very easy. Just go in, you put your name, and you make a password, and then every day you go into that app, and it will show you where you are. So that is a fantastic resource. You can choose your language, which is important to know, because it's important. I think it's important to be able to receive information in the language
you feel
which is your mother language or you're most comfortable with. That's why we've created it for Cyprus in the 5 main languages of Cyprus. So that the information is in our way. And it's actually interesting because a lot of the YouTube videos, you can also see a lot of videos on YouTube, and we have even a higher usage on YouTube than the app itself because it's also being used abroad. Arabic speaking countries are using it because there's very little information of this level in the Arabic speaking countries. Also Turkey and Greece are using it. So it's it's been amazing to see the journey. And now we actually have funding for the 2nd level, which is in Cyprus. We're going to do a bit of a Babybody ambassador work. So to inform people about it so that the midwives and the doctors are more informed about giving it as well. Yeah. So even though it's available, without the marketing that we are doing, how are they going to be able to find it? Yeah. Thankfully, one good thing with technology is that now if people search on anything, Babybody is going to pop up, Birth Forward is going to pop up. It's very difficult to go and search for anything to do with babies and pregnancy and not find that. Yeah. So just go and search for it and you'll find it, But that's obviously number one is information, which was why as a chiropractor, it's so important for me from an ethical point of view to supply people with information. It was so important that I started this Birth Forward. So I couldn't reach out to everybody, so I thought, what can I do for people to get information even if they can't get chiropractic care. I don't have access to that. I've not made a big agenda of bringing chiropractic into that. There are a few little things mentioning chiropractic in the app, but the main thing is to get information about the basics around your rights and the day-to-day work when being pregnant. But of course, as a chiropractor, I would say it's always a good idea to get checked. The earlier the better in the pregnancy. There's no danger at any time of the pregnancy to see a chiropractor. Often people come after the 3rd month because they're a little bit more skeptical the 3rd month, and often they have been told not to exercise and different things like that, so they are more skeptical to come in the first few months. That's fine, but it's safe because if you go to a chiropractor that specializes in that and has an experience in that, we have particular techniques that are geared to that. It's not chiropractic is often specialized in different fields outside our typical, back pain and neck pain areas and wellness. We specialize maybe in sports, so we specialize in, different areas, minus pediatrics and pregnancy. So that is it's a good thing to do because you can get to know early if there are anything that needs to be cleaned up and cleared up so that your pelvic muscles and pelvic girdle is in a good place. You can go through pregnancy with as least possible pain. We work with the pelvic girdle complications and help to stay in a fit state throughout the pregnancy and optimized state so that the baby can have a good rumble around in there without having any, restrictions from that perspective at least, right? So, but sometimes even, working with people's previous issues like neck pains and headaches and postural aspects are equally important.
That can also help.
Because that helps the overall outcome. My goal is to get the best possible environment for that baby to be born in.
Yeah.
Right, so that the baby takes their first breath with the most optimized way. And the mother being informed, the environment being healthy, the mother being in a healthy state, being in a place where she knows she can get information and not fear, that all of that matters. So it's a complete kind of, story. And of course it all started, I know you had the question for me about my own births, because
I was about to complete this with that story. So.
Exactly, yeah. So I had 2 very beautiful births, one in the main hospital in Makario in Cyprus and the other one at home. And I was very fortunate. I have a beautiful midwife at the hospital that looked after me throughout the entire time. And I was fortunate to be able to see her for my checkups, and then later on, when I gave birth, she was there as well. So it was a really strong, long labor, 18 hours, and it was beautiful. And the birth really needs to be 18 hours because you need that time to kind of allow for your body to give birth. The first births are often a little bit longer because of that. The body needs to open for the first time. And I remember it was a bit funny because I remember there's 2 ways of measuring how much you've dilated. One is by the fingers, which is like each finger counts as 2 centimeters, so you go to 5, and the other is by centimeters, which is 10. And on the chart on the walls, it was 10 centimeters. They were showing the 10 centimeter chart, but the midwives were talking more the hand language, which is the 5. So I kept hearing, it's 1, it's 2, and I was like, 1, I've got a way to go.
No.
And it's like, it's 3 now, it's okay, and I was still in 3 centimeters, 4 centimeters. I was like, oh my goodness, I better pace myself. I was all informed, and happy and no problem, and I was like, really good. And she was talking about 4, and I was like, okay, we've got a long way to go. And then I'm like, I feel I need to push. Like this is too early. Yeah. And that was so funny when she's like, no, you fully dilated. It's 10 centimeters. I'm like, what? And it was amazing because that last hour and a half, which was a long transition actually. I had a very long labor stage. The second stage was long. And it was wonderful because I had so much energy because I realized that I'm also going to go until 6 next day, So it was amazing because I had so much energy when the actual birth, and I needed that because it was a long transition. And so that was the second stage of the birth. And then the placenta came out nice, and he was just right on me. He was breastfeeding right away. Yeah. And we just stayed together, and it was beautiful. But I did have some drama the week before because I was well overdue. I was like 11 days over. And they were stressing out in the hospital that, you need to sign, in case we need to do Caesarean, and you have to stay in, and we need to monitor. And I was like, no, I am okay. Everything is fine, It's checked. It's good. And so I had to push quite a bit, but thankfully to put my boundaries because I didn't want to get induced without reason. And there was no reason. Everything was fine with the baby. Everything was fine with me. So I had then the waters broke in the morning, and thankfully on the 11th day, and I was like, I didn't have to go in and argue again. But that was an amazing experience, and I really needed in that birth the support of the midwife. Yeah, I was so well supported and protected, and she just was there. She stayed with me all the way through the labor. I was there at 5 in the afternoon, I think, because it started in the early morning, but I was at home, and I went there at 5 in the morning 5 in the afternoon. We went for ice cream. We went to the clinic. I got adjusted from my husband, and then we came to the hospital about 5 in the afternoon. And then I obviously already was quite far, much further than I thought. And then we gave birth, and everything was really good because he could just latch on, and the feeding was so good from day one. And the second birth, which I then had a bit more experience, and I felt that I knew my body. For me, it was okay to give birth in the hospital the first time. I didn't really want to be at home at that time. I felt I needed that
support system. I was going to ask about this.
I didn't have an urge to be, away from that environment then. But when I came to my second birth, I really felt that, I'd had the experience. My body was well capable of giving birth. And I was in a really confident state. I had learned so much, and yes, I have the knowledge from a professional point of view, but forget that. You still got to have the personal experience. Really,
I was about to say that. Yeah.
So the personal experience was important, and then I really wanted to have a natural birth. I applied to the government and the Ministry of Health of having a home birth with my midwife. I got the answer that we acknowledge that you have the right to give birth where you want, with who you want, and how you want. But unfortunately, we don't have the system in place for that. So no, you're not going to get your midwife, public midwife. So that was a little bit of work. And it wasn't actually until the last month that I managed to get it together, where I had 2 midwives that was retired but still registered. So they were in a position where they could support me at home. It's very important, I think, to have the right support and to be properly. You don't play with this. Like this is not something you play with.
I was gonna ask,
and you don't play with it when you go in a clinic, or you don't play with it at home. I mean, you have to be
serious about it.
Clear, like you have to be safe when you're going to give birth. There can be complications, and you don't want to be reckless about things. But I think it is a very natural process, and in most of the times, you will see if things are starting to deteriorate. If you go through a natural process, you will see it. It will be evident that things are not moving on as they should, and then you should transition, of course. So we had the connection with the Larnaca Hospital. I had my checkups there. They knew I was going to give birth at home. It was
so if anything happened, they could move you from
transition
there.
in there. Yeah, I was close enough. So that was fine. But yeah.
Was it a water birth?
Yes. So then I had a water birth at home.
Yeah.
So I had attended a couple of water births in Cyprus before. So I had all this experience from attending them, and I saw that looked really nice. So I really wanted it, and it was so nice. It was just incredible, the relief, from the contractions, and it was so nice to be with water, even in the shower with hot water on the back, and I was just moving and doing all my things. And I called the midwife and I said, I was 3 days over, so I didn't really believe I was going to go into labor, because I thought I was going to go 10 days over again. And but the contractions were really getting stronger and stronger. And then I woke up my husband. I called the midwife. One of them arrived in time, but the other one came 15 minutes later. And I had this amazing experience, because it was really the whole birth. I felt like I was just listening to what Matthäus was wanting. Yeah. And, he kind of threw me around. I was forward, I was backwards, I was in the shower, I was kneeling on all four. I was just listening to what does it feel like we need to do now for this next stage. So with every contraction, I had moved around and wiggled around so that he moved and wiggled around so that he was in a better position. I was in a better position. The next contraction was more efficient, and he was coming down so nicely. So about 5 hours the labor was. And then I was in the pool, and again, the midwife totally left me to do my own thing. She said, whatever you feel like doing, do it. Only once I looked up, and I was like, and it was exactly when the baby was coming. Yeah. I looked up, and she just do what you feel like you need to do. That was the only thing she ever did, touched me, anything. She was just in the background. Yeah. And I just focused in my body, and I was just very, very present. It was the most spiritual experience I ever had, because it was so beautiful. And we were so in tune with the baby. Like, we really worked together. Mm-hmm. And then he came out of the sack. He was actually in the sack when he came out, in the water. And I was sitting backwards, and then the first compression, I just had 3 contractions for him to come out at the end, and I was sitting backwards. He came out, and then I leaned forward. I was leaning forward, and I sat back so that I could take him up myself. Yeah. And I held him in the water a little bit before he had to take his first breath. And this is important, because when he was in the water, they only take a breath when they feel air here underneath the nose, right? So as soon as there's air, because inside there's no air, right, in the uterus. So the baby's in the water already, and he was coming out in the sack anyway, so he was still in the water. Then the sack broke, and then he was in that water that was the same temperature as the water he came from. So what I experienced was that he was filled with the blood from the placenta for quite a few seconds before I carefully took him up, and I took his head up like this, slowly out of the water, and then he took his first breath. Yeah, and it was so easy, so easy, because there was humid environment, it was wet, it was warm, his body was still in the water warm, there was no shock, stress on him. And I'm telling you, this kid is something else. He is just, if there is any truth in what I say, I can prove it from this one, because he came out and he was just prepared, like for everything. He is so switched on and so interesting as a person.
He's the kid we were talking about before, Matthias, who doesn't see any barriers.
He doesn't see barriers because he didn't have a barrier. He didn't have to force through barriers. And I think this is actually part of it, is that he worked through that process and came out, and he just, the whole process was so natural and so free and so good for him that he could, take that choice. That's nature for him.
Yeah.
That's nature for him, right? That's how he came out. And that's how he is in life.
Yeah.
Very, very calm but confident, with such a calm, focused mind to do the things he wants to do, and he achieves them. So it is, just observing it from those different environments. With Sava, I had big traumas in the pregnancy itself. I had bleedings. I was actually couldn't work for the good majority of the pregnancy, and because I had hemorrhages, I had the placenta was what's it called in English? I had a bit of detached placenta, so there was bleeding throughout the pregnancy, and it's quite a a lot of stress in a sense in that pregnancy. Also, there was stuff with work, and I was traveling, and it was a much more stressful pregnancy. It was a much more stronger delivery. I needed more support in that delivery because I didn't know, and he was born, after many hours and a lot of intensity, and it was all beautiful and good. But I can see that he needs a different level of support, a different way of how he gets to things.
Yeah,
he needs a bit more support. He had a lot of more barriers on his way before he was born. So it's just so interesting, and I can just talk from my 2 births and from all the children that I've seen. Hundreds and hundreds of babies and their stories, and I see that there is a pattern of these things that I'm very interested in. So it was a beautiful experience, and I think that is something that birth is beautiful. It is amazing. It's not even painful. If you go through the natural roads of things, your body is a complete pharmacy, of everything you could possibly need, of pain medication and hormones that helps you to go through all of that, so that it numbs the pain. So I didn't think I was in pain in birth. I never thought about it as pain. It was just like you prepare yourself to run or to go, like we spoke about before. You know that is an active pain, but it's not pain as such. You just go through it because it's an action, right? And the same with birth. Birth is a beautiful experience, and we're actually doing a strategy now until April. We're going to do a natural birth. The natural birth strategy is actually happening in Cyprus. In April,
exciting.
They are going to write it. We worked since 2016. It was promised by the Ministry of Health back then, and now it's happening. So they're actually writing a strategy for natural birth in Cyprus, which hasn't
to make it
existed
available to the public. Yeah.
Well, to get a strategy for it, what is it? What does it mean, natural birth?
Oh, okay.
From a government point of view, from a ministry point of view. So there is actually a birth strategy being written in April. So we're doing a bit of campaigning now in the next 4 months for that, to people to understand more what is natural birth. Because we don't really have a very clear image of what it is. So that's why we're going to talk a lot about positive birth stories, because that is part of it, is to actually hear the positive things. It's not just.
But it's so interesting as well. This is the first time I've heard a testimony like that, and it's beautiful. Yeah,
my little boy, the 2 or 3 year old, he was there. He was checking the water, and he was making sure everything was okay. The cat came in, and it was just amazing, And he was he tells the birth story. I have a video of him asking him what happened.
Was it traumatic for him?
No, he was it was easy. My mommy pushed 3 times. The baby came out. That was it. He was, for him, birth is easy. It's no drama. He was no, I was in the what? Push a baby, baby comes out, baby was fine, baby was. Yeah. So how does he support his partner if he's in a relationship and they're going to have children? How will he support? How will he be as a father? He will be in that moment. Yeah. For him, that would be well, of course we do this. And,
my mom.
It's easy. What's the stress, So he can be a supportive partner.
So Dr. Eline, thank you so much
thank you.
For being here and giving your time and sharing all these stories and becoming vulnerable, because it shows that you're a very strong person in order to do such a thing. And thank you. And I really hope that people hear these, they're inspired, and they get to learn something that's going to help them later on.
Absolutely. I hope so too. You know, I'm in a place in my life now that, you know, I don't just practice, but I also teach and do mentoring for other chiropractors and for not just chiropractors actually, but people in leadership situations where they want to create a change in their community. So changing community, we didn't speak about that today, but that's a big passion of mine, is to create change in our community. So it's well, you've heard my story, but it's really nice to be able to share this. I think what you're doing is brilliant. I think it's really, really nice to hear about your podcast, as I said, and I'm interested to have more conversations with you. I think it's fantastic that people are coming out of university, you know, with already having knowledge about what other people do. Yeah, bridges. For you, it bridges things so that you understand, you know, what is going on. And people that listens to this, and particularly if people in the study years can listen to and collaborate and get to understand what all these other professions are about, then you have so many more tools, because you don't have to fix them all yourself. You know, you work with people to help people. And it's that's the core.
You said this at the beginning as well, with informed getting the information in order to make the decisions. And we have a lot of viewers here who are medical students. And I think getting that information and getting to know all the aspects of all the other healthcare professions that are around medicine, is not just us. There's so many other people working with each other for the health of the patient. I think that's going to help in that aspect as well. So
it is, and it shows that people will feel more trust if there is collaboration. Yeah. Because people are now in two camps, right? They are going either, or they could do both, maybe go with more natural ways, and it's often disjointed from the medical way. And that's a shame, because people choose it. Like, we're talking about 50-60% of the population are choosing alternative ways as well, right? So how can we bridge these conversations so that it feels more confident for them to go, hey, I can go to my doctor, I can speak to them about what I'm doing outside of the medical to stay healthy, and same way they can go to me and speak to me about what's happening at the doctor. Or, you know, of course we are more kind of on the medical side maybe than many other professions, but we have to be more broad to what people's choices are.
And it shows the need that, what you said, it shows the need that people it shows that what we're doing in medicine, sometimes it might not be enough for the patient. The fact that they're seeking out, so many of them are seeking out other alternative practice, and we can learn from each other. Because maybe something that alternative medicine provides, that we don't have. And I'm sure that both of us can learn from each other. Both of us, again, I'm splitting it. All of us can learn from each other.
That's where collaboration comes in, and facilitated conversations comes in, and just what you do is coming in, which is very important.
Thank you so much. Thank you so much. It was a lovely episode.
Very nice to meet you, and thank you so much for inviting me. I really appreciate that.
It was a pleasure.